My name is Dr. Daryl Dykes, and I'm here to talk about total shoulder arthroplasty. Total shoulder arthroplasty is for people that have a worn out glenohumeral joint, which is the ball and socket of your shoulder. Most people have lost range of motion in the shoulder. It's very painful both in the anterior and posterior aspects of the shoulder. Common treatments for arthritis of the shoulder are injections, anti-inflammatories, physical therapy, but for some folks you can try all that and you continue to have a very painful joint. X-ray findings usually show bone-on-bone wear within the shoulder, and the general premise is that you try to resurface the inside of the shoulder joint to get a more functional, happy shoulder. On the shoulder socket side, we apply a plastic covering to resurface the socket of the shoulder. This is performed either with cemented pegs on the back side. Some of the systems also have a porous ingrowth post where it's a metallic post that's attached to this covering, which allows your body to grow into the implant, which helps with fixation over the long term. On the humeral side, or the arm part of the shoulder, the way the procedures are performed, the top of the humerus is such. We go in the front of the shoulder. We take off the diseased head of the shoulder. We use a variety of broaches to open up a hole in the proximal humerus. We have metal stems that are inserted into the shoulder joint. The top of the stem has porous, rough metal surfaces, which allows your body to grow into the implant, which also helps with fixation in the long term. The stem is placed into the humeral head. We replace the ball with a metallic ball. This fits and locks into the stem, and the way the humerus or the total shoulder works is that the ball then rubs on the nice smooth plastic liner, and this gives you a functional, painless joint in the long run. This procedure does entail quite a bit of therapy afterwards. As you can imagine, the shoulder moves in multiple planes. The shoulder can flex, it can abduct, extend, abduct overhead, and all these planes of motion, and strengthening the rotator cuff after the procedure takes a fair amount of time. For most people, it takes approximately 2 to 3 months to fully recover from this type of surgery. The procedure is very effective. Most people are very happy with it. This is a mechanical component though, and the average person obtains approximately 130 degrees of abduction. It is not impossible to get full range of motion with the implant, and it really depends on the patient. This type of procedure does require a good, diligent patient to do the therapy as we prescribe to get a good result. After the procedure, immediately, we use a waterproof dressing so that you can shower after the procedure. This allows you not to have to do any dressing changes for the first 7 days after the procedure. We usually have you come back to the office at about 2 weeks after the procedure to have your staples removed. We do a wound check and do an x-ray at that time. I usually start formal therapy at that time. Immediately after the procedure, the primary focus is on gentle range of motion in the shoulder, and especially emphasizing elbow, wrist, and hand motion. You certainly don't want to neglect the joints below the total shoulder, as they are critical for good upper extremity function, just to get your hand up here to your mouth or your top of your head. So that is a very important part of the procedure immediately after the operation. Most of these procedures are done as an outpatient. You go home immediately after the operation from the hospital. We usually use an interscalene block where they block the nerves along the side of your neck. That gives you a numb arm after the procedure. It dramatically helps with the pain. We also do a local injection in the incision itself, which also helps with long-term pain control. And once again, most people can go home the day of the procedure. You usually are more comfortable sleeping, sitting up in an easy chair after the procedure for a few days after the operation as well. You would go home with narcotic medications to help with pain. If you feel like you may be a candidate for this type of operation, please feel free to contact us at Alabama Bone and Joint in our Pelham office. The number is 205-621-3778. Thank you.